Hello everyone. Today we are going to start with our new topic, health indicators, which is a part of the community medicine. So, what does it mean by the health indicators? Basically, it reflects the health status of a population and it measures the health. Okay. Now, there are several indicators which are used for the health status of the community. So now let's understand what will be the characteristic of the health indicators. It will be such as valid, reliable, sensitive, specific, feasible and relevant. What does it mean? Valid means to measure what they are supposed to measure. Reliable means the result should be same when measured by different people. Okay, now sensitive means it is sensitive to the changes in the situation, and specific means it reflects the changes only in the situation concerned. Now, what do you mean by feasible? It should have ability to obtain the data needed. Okay, now relevant, it should contribute to understanding at the phenomenon of the interest. Now, let's start with the various health indicators. Various health indicators such as mortality indicators, morbidity indicators, disability indicators, nutritional status, healthcare delivery indicator, utilization rate, indicators of social and mental health, environmental, social, economic, health policy indicators, and indicators of quality of life. So, first we start with the mortality indicators. Okay, so in mortality indicators, what what are the following things? Such as crude death rate, age specific death rate, expectation of life, infant mortality rate, under 5 mortality rate, child mortality rate, and the maternal mortality rate, maternal mortality ratio, disease specific death rate, proportional mortality rate, case fatality rate, and years of potential life lost. Okay, now what do you mean by crude death rate? So basically, crude death rate means the total number of death divided by the mid-year population in 2000. What does it mean by the mid-year population? It is basically calculated on the 1st of the July. Okay, now what does it mean by the age specific death rate? Suppose there are various age group, such as if we take example of 22 to 20 to 25 years. So in total number of death of age 20 to 25 years divided by mid-year population of 20 to 25 years in 2000. Now, what does it mean by the expectation of life or life expectancy? Basically, it is a positive mortality indicator. It is average number of years a newborn is expected to live based on the current age specific mortality rates. So, good indicators. It is a good indicator for socio-economic development status of a country. Okay, now adult mortality rate, probability of dying between the age 15 to 60 years per thousand of population. Okay, now years of potential life lost. Okay, this is the years of life lost to the premature death. It is also one of the previous year of NEET PG. Okay, arbitrary age such as um, 75 years. Okay, YPLL, which is years of potential life lost. It is a mortality indicator which shows the number of years that a dying person could have expected to survive. Usually, it is taken as 75 years, and it is also used to estimate the societal impact of premature death, prioritize public health intervention, and allocate resources to address health problems. Now, morbidity indicators. What does it mean by the morbidity? Morbidity means the spells of sickness due to disease. Okay, there are such as incidence and prevalence. What does it mean by incidence? Incidence means the new cases, prevalence means the total number of existing cases, notification rates, admission, readmission, and discharge rates. Now, other indicators of morbidity such as duration of stay in a hospital or health care, attendance rate at OPD or health center, spells of sickness or absence from school or work. Now, what does it mean by the disability indicators? Disability means any restriction or lack of ability to perform an activity. If we are unable to perform any our work or job, this can be event type or person type. Now, event type means number of days of restricted activity, bed disability rates, now work or school days lost within a specified period. Now, in person times, there is like there is always be a limitation of mobility or activity. Okay. Now, what are the different disability indicators such as DALY, which is disability adjusted life years. It is YLD plus YLL. YLD means year lost to disability and YLL means years lost to premature death. Now let's understand. Suppose there is a person whose average lifespan is taken as 0 years to 80 years. He should survive, okay? He should live. But at 40 years he is diagnosed with some of the chronic heart disease, okay? Now at 60 years he by this disease he had faced death, okay? Now this 20 years of gaps, it is the period of it is the years which he has lost due to disability, and another 60 to 80 year lost to premature death. It means if he or she doesn't have any chronic disorder, he would have lived up to 80 years, but due to CSD he has only lived only up to 60 years, okay? Now one DALY means one healthy years of the life lost. It is the best measure of burden of disease and effectiveness of the intervention. Now, wildly, what does it mean? Wildly means where the number of incident cases due to injury and illness it is multiplied by the average duration of disease and weighting factor reflecting the severity of the disease on a scale from 0 to 10. Okay, wildly it is a scale. 0 is for perfect health and 10 is dead. YLL is years of life lost calculated from number of deaths at each age multiplied by the expecting remaining years of life according to a global standard life expectancy. Okay. Now another indicator says health adjusted life years. Number of years a newborn is expected to live in a full health or good health based on the current rates of ill health and mortality. Okay. Now adjustment made for time spent and poor health status or sickness. Now what do you mean by the Sullivan's index? It is the disability free life expectancy. So basically it what does it mean, how many years the person is free or free from any other disease. So we can calculate through the life expectancy minus the duration of the disability. Okay. Now one is quali. What does it mean? Quali means quality adjusted life years. It is the gain in the quality years of life due to an intervention at community scale. Measure of disease burden including both the quality and the quantity of life lived. 1 year in perfect health, 1. So here the scale is perfect health is 1 and death is at 0. And in daily the scale was 0 to 10. Okay. Now healthcare did other healthcare delivery indicators such as doctor population ratio, doctor nurse ratio, population bed ratio, population per health sub center, population per trained birth attendant. Okay. Thank you so much, guys.